Hi, I'm Dr. Bozeman, and I want to address a question. And this question is kind of long, so I'm going to read it out so everybody can hear it. It says, I had a car accident 3 years ago. My car was totaled, and since the other driver didn't have insurance, I didn't want to rack up a large treatment bill. My neck was hurting, but nothing I couldn't take care of my own without treatment. My neck pain is excruciating 3 years later, and was told I need a cervical fusion. Could this surgery possibly have been prevented if I sought care right after my accident? Well, that's a good question. And now, without knowing all the facts and all the history, it's hard to answer that. But the incident of chronic neck pain and advanced degenerative changes in the neck without is well documented post motor vehicle collisions. And if part of our goal in practice is we manage those as early as we can, appropriately as we can, to help optimize healing to avoid chronicity of complaints. Some people are going to develop chronic pain because of the significance of the injury and the amount of injury that's involved. But if we were to back up 3 years ago and in the perfect situation, begin treatment early on, address some of the inflammatory properties, some of the muscle spasms, some of the biomechanical dysfunctions, and help you improve those, then 3 years down the road, our anticipation of having chronic, ongoing, excruciating pain is certainly the goal is to minimize that. So it's very hard to say that if you had done something 3 years ago, and particularly with a case like this, would it have changed the outcome down the road? It would be a disservice to say, yes, if you'd came in and seen us, you wouldn't have to have surgery. But that's not necessarily true. But that is the goal of care, is to avoid things just like that. And you see a lot of people sustain injuries. Whether the post-injury maintenance of that injury is not done properly or lacking completely, you can develop scar tissue. You can advance degenerative changes. Your biomechanical dysfunction will lead to wear and tear and add additional stresses on a daily basis with every activity you do. And these things tend to compound over time. So ultimate goal, if you get injured, get checked out. If you need assistance with what to do properly after an injury, do whatever you can to get that looked at, and make sure that there's people out there who are willing to help you and guide you in the right direction. It's not all about insurance. It's about you getting injured and you getting the proper care you need, or at least the proper guidance to have the best chance to recover. Thanks, guys.